Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a consultant doctor talking to a patient called Emily. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi, Doctor. Thanks for seeing me today.
Of course, Emily. What brings you in today?
Well, I've been really struggling lately. I'm not sure how to explain it exactly, but I think I might have OCD. I've been doing a lot of research online, and a lot of what I'm reading feels very close to what I'm going through. I've been feeling overwhelmed, and it's affecting my day-to-day life.
I see. Well, thank you for bringing this up. It sounds like it's been difficult for you. Let's start by discussing what you've been experiencing. What makes you think it might be OCD?
I've always been a bit of a perfectionist, but recently, it's gotten worse. I find myself obsessing over small things, like whether I've locked the door or turned off the stove. I'll check and recheck multiple times, even when I know I already did it. It's not just a quick check, it takes me several minutes, sometimes longer. I just can't seem to stop myself, and if I don't do it, I feel this intense anxiety like something bad is going to happen. It's exhausting.
It sounds like these thoughts and behaviors are really interfering with your daily routine. How long have you been experiencing this?
It's been a few months now, but I think it's been building up for a while. At first, it was just small things, like double-checking if I locked the car. But now it's happening all the time, and I feel trapped in these patterns. I'll spend 20 minutes just checking things before I can leave the house. It's gotten so bad that I'm late for work or other appointments because I can't leave until I'm sure everything's right.
That does sound distressing. OCD often involves these repetitive behaviors or compulsions driven by intrusive thoughts or obsessions. You mentioned that you feel anxious if you don't go through these checks. Do you notice any other patterns of thoughts or behaviors?
Yes, it's not just about checking things. I also have this fear of germs, and I wash my hands constantly. I know it's excessive, but I feel like I have to do it to stay clean. Sometimes, I'll wash my hands so many times that my skin becomes dry and cracked. I also have certain routines I follow, like needing to arrange things on my desk in a particular way. If something feels out of place, it bothers me until I fix it. I know these things sound irrational, but I can't seem to stop myself from doing them.
It sounds like these compulsions are taking up a significant amount of your time and causing distress. It's important to know that OCD is a recognized mental health condition, and you're not alone in feeling this way. Many people with OCD experience similar patterns of obsessive thoughts and compulsive behaviors. It can be very difficult to manage on your own.
That's exactly how I feel. I know these thoughts don't make sense, but I can't get rid of them. I'm constantly worrying that if I don't do these things, something terrible will happen. It's like I don't trust my own mind anymore.
I understand. OCD can create a cycle where the compulsions temporarily reduce anxiety, but the intrusive thoughts keep returning, reinforcing the behavior. The good news is that there are treatments that can help break this cycle. Have you ever spoken to a therapist or considered seeking treatment for these symptoms?
I haven't talked to anyone about it until now. I've been trying to handle it on my own, but it's getting to the point where I don't think I can. I've read that therapy can help, but I don't know where to start.
Therapy, particularly cognitive behavioral therapy, CBT, is often very effective for OCD. There's a specific type of CBT called exposure and response prevention, ERP, where you gradually face the situations that trigger your obsessions without performing the compulsive behavior. Over time, this helps reduce the anxiety and breaks the cycle. In some cases, medication can also be helpful, especially if the OCD is severely impacting your ability to function. Would you be open to exploring therapy as a treatment option?
I think I'd like to try therapy. I've read about ERP, but it sounds a bit scary. I'm not sure if I'll be able to handle the anxiety.
It's completely normal to feel apprehensive about starting therapy, especially ERP, as it does involve facing your fears directly. However, it's a gradual process, and you'll be working with a therapist who will guide you step by step. The goal is to help you feel more in control of your thoughts and behaviors over time. If you're feeling overwhelmed, we can also discuss medication options to help manage the anxiety while you work through therapy.
That sounds like a good plan. I think I need help with the anxiety too, because it's just so intense when I try to resist the compulsions.
That's understandable. There are medications such as selective serotonin reuptake inhibitors, SSRIs, that are commonly used to treat OCD. They can help reduce the intensity of the intrusive thoughts and compulsions, making it easier to engage in therapy. We can explore that as an option, but it's entirely your choice.
I'm open to trying medication if it will help. I just want to feel like myself again. Right now, it feels like this disorder is controlling me.
I understand.
Extract 2, questions 13 to 24. You hear a pediatric cardiologist talking to a mother called Mrs. Thompson. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mrs. Thompson. I know you've had a lot of information to process in the past few days, and I'm sure it's been overwhelming. I'm here to answer any questions you might have about your baby's condition and explain the steps we'll take moving forward.
Thank you, Doctor. We're trying to understand everything, but it's been tough. When they told us our son has something called pulmonary atresia, we were in shock. What does this mean for him? Is it as serious as it sounds?
I understand how frightening it can be to hear that diagnosis. Pulmonary atresia is a congenital heart defect, which means your baby was born with it. Essentially, it's a condition where the valve that normally allows blood to flow from the heart to the lungs, the pulmonary valve, hasn't formed properly. This means blood can't flow directly from the right ventricle of the heart to the lungs to pick up oxygen.
So, if the blood can't reach the lungs, how is he surviving right now?
That's a good question. Babies with pulmonary atresia often rely on a small connection between two arteries called the ductus arteriosus. It's a normal part of fetal circulation, and it allows blood to bypass the lungs before birth. However, after birth, babies need to get oxygen from their lungs, and since the pulmonary valve is closed, we'll need to keep that ductus arteriosus open for the time being. Right now, we're giving him medication called prostaglandin to keep that duct open so that blood can flow to the lungs.
That explains why they started him on medication right after he was born. But is the medication a long-term solution, or will he need surgery?
The medication is a temporary solution, and surgery will definitely be necessary. The goal is to create a more permanent way for blood to flow from the heart to the lungs. There are different surgical approaches we can take, depending on the specifics of your son's heart structure. Some babies may need a shunt placed, which is a small tube that helps direct blood to the lungs. Others might need more complex procedures to fully address the defect.
And how soon will he need surgery? Is it something that has to be done right away?
In most cases, The first surgery happens within the first few days or weeks of life, depending on how stable the baby is and how well they're responding to the prostaglandin. We're monitoring your son closely to make sure he stays stable, and we'll likely be discussing surgery very soon. After the first surgery, there will usually be follow-up procedures as he grows, since his heart will need to be adjusted as his body develops.
So, he'll need multiple surgeries over time? How does that work, and what are the risks involved?
Yes, pulmonary atresia is typically managed through a series of surgeries. The first surgery, often called a palliative procedure, is designed to stabilize him and allow his heart to function better in the short term. Later on, as he grows, we'll look at additional surgeries to either improve the blood flow further or reconstruct parts of the heart. These surgeries carry risks, as with any procedure, but they are life-saving, and many children with pulmonary atresia go on to live active lives with the right medical care.
And what are the long-term effects? Will he be able to live a normal life?
That's a common concern for parents. While pulmonary atresia is a serious condition, many children can lead fulfilling lives with proper medical management. However, it's important to recognize that he'll need ongoing care from a cardiologist throughout his life. There might be limitations on his physical activities, and he'll need regular checkups to monitor his heart function. Some children may also need medications long-term, depending on how their heart functions after the surgeries.
Will he ever fully outgrow this, or is it something he'll always have to deal with?
Pulmonary atresia is a lifelong condition, but the goal of surgery and ongoing treatment is to manage it effectively so that your son can live as normal a life as possible. While he may never be completely cured, the surgeries aim to give him the best quality of life. Advances in medical technology mean that many children with this condition go on to do very well.
That's reassuring. But we're also worried about his development in other areas. Will his heart condition affect his ability to grow and learn like other kids?
That's a natural concern. Some babies with congenital heart defects like pulmonary atresia may have slower growth early on, especially if they're not getting enough oxygen. However, once the surgeries are done and blood flow improves, many children catch up in growth. Developmental delays aren't guaranteed, but it's something we'll keep an eye on as part of his overall care. We'll work with a team that includes specialists like pediatric nutritionists and developmental therapists to make sure he's getting the support he needs.
Thank you, Doctor. We've been so overwhelmed with everything happening so quickly. It's good to know he has options and that you're here to guide us through this.
Of course. I know it's a lot to take in, but we're here for you every step of the way.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear 2 nurses discussing the effects of mindfulness practices on their mental health. Now, read the question.
So, we've started implementing mindfulness practices for the staff, like meditation sessions during breaks and optional yoga after shifts. The idea is to help reduce stress and burnout levels, especially with how challenging things have been lately.
That sounds really useful. Have you noticed any changes in the team?
Absolutely. Some of the nurses are saying they feel more focused during shifts, and their overall anxiety has decreased. I've personally felt more resilient when handling stressful situations, and I'm not as drained at the end of the day.
How long are the sessions, and is everyone participating?
The meditation sessions are 15 minutes long, and the yoga classes are 30 minutes. Participation is voluntary, but we're encouraging more people to try it. The main thing is that we've noticed improvements in well-being for those who do join.
Now, look at question 26. You hear a surgeon talking to a patient about his surgery. Now read the question.
Thank you. I've been feeling really nervous about the whole thing.
I understand. The hemispherectomy is a complex procedure, but it can offer significant relief from your seizures. You'll only be having surgery on the affected side of your brain, and the other hemisphere will gradually take over many of the lost functions.
That sounds hard to believe.
It does seem incredible, but the brain has an amazing ability to adapt, especially in cases like yours. We've had good results with this procedure. You'll also have a thorough rehabilitation plan to support your recovery.
Okay.
The surgery will take around 5 hours. Does that sound manageable for you?
I think so.
All right. Let's get everything set for the operation.
Now look at question 27. You hear a researcher reporting on some studies he's been conducting on COVID-19. Now, read the question.
My primary area of study is the long-term effects of COVID-19, particularly on the heart and lungs. We know that during infection, the virus can cause significant damage to these organs. However, my research focuses on how this damage persists in some individuals, even after the initial infection has cleared, a condition commonly referred to as long COVID. To better understand this, I've been tracking patients for over a year. My goal is to identify patterns in the deterioration of cardiac and respiratory function, and find ways to counteract these effects. One promising intervention involves the use of specialized rehabilitation programs to help patients regain lung capacity and reduce inflammation around the heart. My team is also looking into how different COVID-19 variants might exacerbate these long-term issues.
Now look at question 28. You hear a trainee discussing with her supervisor the challenges she faced. Now read the question.
Would you mind if we talked about the effectiveness of telemedicine in elderly patients living in remote areas?
Sure. What's on your mind?
Well, I was asked to look into how effective telemedicine has been in providing care for these patients. You know, considering their unique challenges like limited mobility and access to healthcare facilities.
That's an important issue. How did your research go?
It was pretty overwhelming. The data shows that telemedicine has great potential, but when I had to discuss it with a few patients, they seemed really unsure about the technology. It was difficult to explain the benefits while they were hesitant and didn't seem fully convinced.
It's normal to encounter some resistance, especially with new technologies in healthcare.
Now look at question 29. You hear a psychiatrist discussing a patient's case with a neurologist. Now read the question.
I think we're seeing some clear links here between the patient's gut microbiota and their depressive symptoms. Their inflammation markers are higher than normal.
Yes, the gut-brain axis plays a huge role. Have you considered running tests for neuroinflammation?
That's a good idea. I've already started them on probiotics, but I'll look into adding anti-inflammatory treatment if the results suggest it.
Also, we should monitor how they respond to the novel therapy for anxiety we're trialing. Are they showing any signs of improvement yet?
Not yet, but it's early days. I'll continue to track their progress and adjust the dosage if needed.
Great. We should also investigate the PTSD symptoms more closely. There may be overlap in how these neurobiological mechanisms are affecting all three conditions.
Now look at question 30. You hear a pharmacist talking to a doctor about a patient's antibiotic treatment. Now read the question.
I just wanted a quick word about Mr. Jennings' antibiotic prescription. The one for the broad-spectrum antibiotics that you gave him after his last appointment.
Oh yes, for his respiratory infection.
Yes, so he's been on them for a week now, 500 milligrams 3 times daily. The thing is, he's just been in the pharmacy, and I noticed he didn't complete the course. He mentioned he was feeling better, and decided to stop taking the medication.
Really? Well, that's a bit concerning, especially with the ongoing issue of antibiotic resistance. I'll make sure to remind him of the need to finish the full treatment.
Okay, I'll talk to him as well, and stress the importance of adhering to the full dosage. Shall I?
Yes, please. Thanks.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1, questions 31 to 36. You hear an interview with a healthcare administrator about the challenges of implementing new technology in hospitals. You now have 90 seconds to read questions. Welcome everyone. Today we have Sam Peterson with us, a healthcare administrator with over 15 years of experience managing hospital systems. Sam has a background in health informatics and patient management, and he's been at the forefront of several technological innovations in hospitals. He's here to share his insights on the growing challenges of adopting new technologies in the healthcare setting. Sam, what initially drew you to healthcare administration?
Thanks for having me. I've always been interested in problem solving, and healthcare is one of the most complex fields out there. My background in health informatics gave me a unique perspective on how data and technology can transform patient care. I saw how integrating new tools can improve efficiency and safety, and I wanted to be part of that change.
It sounds like you're passionate about innovation. Could you tell us about some of the major challenges you face when implementing new technologies in hospitals?
Sure. One of the biggest challenges is interoperability. meaning that new systems need to communicate with existing ones. Hospitals often use a variety of software and equipment from different vendors, and getting these systems to work together is not always easy. For example, a new patient monitoring system might not seamlessly integrate with the hospital's electronic health record EHR system, which creates inefficiencies and potential errors.
That's interesting. I would have thought the cost of new technology would be the biggest hurdle. Is that not the case?
Cost is certainly a challenge, especially for smaller healthcare facilities. But I think people sometimes underestimate the difficulty of ensuring compatibility between different systems. The costs can actually escalate due to these integration issues, and it can delay the benefits that the new technology is supposed to bring.
So, would you say that the initial investment isn't the biggest problem, but rather making sure the technology actually works as intended?
Exactly. For instance, we've seen hospitals invest in new imaging technology that wasn't compatible with the hospital's radiology system. It led to delays in diagnosing patients, which can have serious consequences. So, it's not just about purchasing the latest tech, it's about making sure it integrates smoothly into the existing workflow.
That makes sense. Now, let's talk about training. I imagine implementing new technology requires a lot of training for hospital staff. How big of an issue is that?
It's a significant challenge, yes. Many hospital staff are already overworked, and finding the time for comprehensive training can be difficult. What's more, the learning curve for some of these technologies can be steep. This leads to staff frustration, and in some cases, they revert to old methods, which defeats the purpose of introducing the technology in the first place.
I've heard that technology can sometimes lead to unintended consequences, like increasing the workload for nurses and doctors. Is that true?
Absolutely. While new systems are meant to make things easier, if they're not user-friendly or if they don't work well with existing processes, they can actually create more work. For example, if a nurse has to spend extra time figuring out a new software program, it takes away from time spent with patients. Over time, this can lead to burnout and reduced job satisfaction.
That's an important point. Do you have any solutions or strategies for overcoming these challenges?
One key strategy is involving the clinical staff early in the process. When nurses, doctors, and other users are part of the decision-making, they can provide feedback on how the technology will fit into their workflow. This can help reduce the likelihood of problems later on. Also, offering ongoing support after the initial training is crucial. Technology evolves, and the support shouldn't end once the system is implemented.
That's a great suggestion. Finally, are there any emerging technologies that you're particularly excited about?
Yes, I'm really excited about artificial intelligence, AI, in healthcare. We're starting to see AI applications that can assist in diagnosing diseases or predicting patient outcomes. These tools have the potential to dramatically improve care by helping clinicians make more informed decisions. But again, the challenge will be integrating these technologies into daily hospital operations smoothly.
AI sounds fascinating, but I imagine it comes with its own set of challenges.
It does. There are concerns about data privacy, especially with AI systems that rely on vast amounts of patient data. And of course, there's the issue of trust. Clinicians need to trust the AI recommendations, and that will take time. However, if we can get it right, the benefits could be enormous.
Well, it sounds like there are exciting developments on the horizon, but also a lot of hurdles to overcome. Thank you for sharing your insights, Sam.
Thanks for having me. It's an exciting time to be in healthcare, despite the challenges.
Extract 2. Questions 37 to 42. You hear a presentation about a recent study on neck pain and its treatment. Now, read the questions. You now have 90 seconds to read questions.
Good afternoon, everyone. I'm pleased to be here today to talk about neck pain, a condition that affects a large portion of the population, particularly those who spend long hours sitting or using computers. Recent studies show that about 70% of people will experience neck pain at some point in their lives, with nearly 20% suffering from chronic neck issues. This is a significant public health concern, as neck pain can negatively impact daily activities, work productivity, and overall quality of life. The primary reason neck pain is so prevalent today is due to lifestyle changes. Many of us are working in jobs that require prolonged periods of sitting or looking at screens, which puts strain on the neck muscles. Poor posture and lack of physical activity further exacerbate the issue, leading to muscle stiffness and tension. Neck pain can range from mild discomfort to severe debilitating pain that limits movement. However, the majority of cases do not require surgical intervention. In fact, most instances of neck pain can be managed through non-invasive methods like physical therapy, exercise, and changes in posture. That brings us to the focus of our study. The aim was to explore the effectiveness of different non-invasive treatments for neck pain and to identify which approaches could reduce the burden on healthcare services. For example, neck pain is one of the most common reasons people seek medical care, especially among working-age adults. But many of these cases, if managed properly, do not require medical intervention beyond an initial assessment. Our research found that educating patients about posture and ergonomics significantly reduces neck pain symptoms in many individuals. A simple change, such as adjusting the height of a computer monitor, can greatly reduce strain on the neck. We also looked at exercise therapy, which was another key component of the study. Patients who engaged in regular neck strengthening and mobility exercises saw substantial improvements in pain and function. These exercises don't have to be complicated. Something as simple as regular stretching of the neck and shoulders can make a huge difference. Another important finding was the role of stress in neck pain. Many patients reported that stress exacerbated their pain, leading to muscle tension and stiffness. We included stress management techniques such as mindfulness and relaxation exercises as part of the treatment approach, and the results were very promising. Patients who practiced these techniques regularly reported not only less pain, but also improved mental well-being. The impact of the study on healthcare services was significant. By empowering patients to manage their neck pain through education and exercise, we were able to reduce the number of unnecessary medical appointments. For instance, before the study, patients with chronic neck pain would often make multiple visits to doctors and physiotherapists, seeking relief. But after the educational and exercise programs, many patients felt confident enough to manage their pain at home, reducing the strain on healthcare providers. We also found that many cases of neck pain, if left untreated, could become chronic and lead to long-term disability. Therefore, early intervention is crucial. For patients experiencing mild to moderate neck pain, addressing the issue early through non-invasive methods can prevent it from becoming a persistent problem. This also benefits the healthcare system by reducing the number of chronic pain cases that require more extensive treatments, such as surgery or long-term physical therapy. As part of the study, we developed an educational workshop that focused on posture, ergonomics, and exercises for neck pain. Patients attended small group sessions where they learned about the importance of maintaining good posture and how to adjust their work environment to minimize neck strain. These workshops were designed to be interactive, allowing patients to ask questions and practice the exercises with guidance from a physiotherapist. Patients were also provided with informational leaflets to reinforce what they learned in the sessions. After attending these workshops, we noticed a significant reduction in the number of follow-up appointments needed for neck pain. Patients who took part in the educational sessions and followed the exercise programs were more likely to experience improvements in their symptoms. Additionally, patient satisfaction was very high, as many participants appreciated the practical advice and felt more in control of their condition. To summarize, the study demonstrated that non-invasive treatments, particularly education and exercise, are highly effective in managing neck pain. This approach not only improves patient outcomes, but also reduces the burden on healthcare services. For patients, the key takeaway is that many cases of neck pain can be managed with simple changes to posture, regular exercise, and stress management techniques. These strategies can significantly improve their quality of life and help prevent chronic neck pain from developing.
That is the end of Part C. You now have 2 minutes to check your answers.